We're about to go through a number of changes at Willis-Knighton. Perhaps the most exciting is the installation of our new proton therapy system. The Proteus One is the new compact pencil beam scanning system from IBA, and we have the first facility of its type in the world. We're in the construction right now, construction phases. The building is underway, and soon we will be installing the technology. And we're very excited about the changes that IBA and Proteus One are going to bring to our center and to the city. The decision to move into proton therapy is not something that you do quickly. We had been considering a move into proton therapy for about 7 years. For us at Willis-Knighton, proton therapy was a natural transition. You know, we started out being very early pioneers in 3D conformal therapy, and then very early users and adopters of intensity modulated radiation therapy, and subsequently image-guided radiation therapy. And I think any site that has been early leaders in technology are naturally drawn to the benefits of proton therapy. We're hoping to take the Proteus One to new levels as far as access to patients. Historically, proton therapy is widely used and certainly widely accepted in the treatment of children and pediatric malignancies, in prostate cancer, in some lung tumors, and brain and spine tumors, orbital tumors. We believe this technology, though, can expand the number of patients. Our interest is to expand proton therapy with Proteus One into cervix cancer, pancreatic cancer, head and neck cancer, perhaps even left-sided breast cancers after a mastectomy. We feel like the technology is ready to explode, and the reduced cost, the reduced footprint, and the advancements in technology have made that happen. Proton therapy has an inherent advantage over photon therapy simply based on the biological characteristics of the proton. You know, as a proton is accelerated to a very high speed and passes into a patient on its way to attacking a tumor, it delivers a relatively low dose to tissues on the entrance. Most people are familiar by now with the concept of the Bragg peak, which is simply that at the end of its path, the proton therapy deposits all of its energy in a very narrow band, so that beyond the tumor, if you can arrange for that Bragg peak to be at the tumor, there is no exit dose. What this results in is a very high explosive dose of radiation right to a tumor with low entrance dose, no exit dose, setting up a physician to carefully plan a radiation attack to destroy a tumor while sparing the surrounding tissue. In addition, the Proteus One, by nature of being a spot scanning or pencil beam scanning system, will be able to use super strength magnets to help deposit a more narrow beam of protons into a small spot within a tumor. Over a couple of minutes, we'll be able to deposit thousands of these spots of varying sizes so that you can essentially spray paint a tumor while giving almost no dose to the surrounding healthy tissues. This is going to result in an extremely conformal dose of radiation without the surrounding healthy tissue doses that IMRT or 3D conformal radiation therapy require. To develop proton therapy, and especially to work with more advanced forms of proton therapy, such as pencil beam scanning and intensity modulated proton therapy, you have to have an expertise in the development of new technologies, and you have to have a very devoted and strong physics division. I think what developing and bringing on proton therapy in the Proteus One to Shreveport does is tells the radiation oncology community that we're leaders in the field, that we have experience, and that we're prepared to invest in the well-being of our patients. there will always be naysayers regarding proton therapy, and most of those folks have a problem with the cost of proton therapy. It's very interesting to me because in the big picture, even though proton therapy is clearly at this time more expensive than intensity modulated radiation therapy or 3D conformal therapy or brachytherapy, I think if you look back, any new radiation technology is historically initially expensive. And if you look and compare in healthcare dollars the cost of proton therapy for the number of patients it serves, I find it to be actually very cost effective. Many targeted therapies and chemotherapy agents can cost many, many times more than proton therapy and serve a much smaller population of patients. All early technologies are expensive. Over time, it is clear the cost of proton therapy will come down, but what is also clear is the dosimetric advantages are huge. It's our expectation that with smaller centers, you will not require the same number of engineers and physicists that you do for the larger centers. With the smaller footprint, your construction costs significantly go down. Many of the proton centers that exist around the world are freestanding facilities that require their own properties, whereas at Willis-Knighton, the Proteus One will be extended right next to our current cancer center. Radiation therapy has demonstrated improvements in outcome that we never imagined 30 years ago. If you look at the breast cancer data, there was a time when they said, well, radiation therapy to the breast or to the chest wall after a mastectomy was simply to reduce the risk of local recurrence. But as we followed patients longer term, as we began to recognize the improvements in systemic treatment, such as chemotherapy, reducing the risk of local recurrence has begun to lead to survival advantages. Proton therapy offers us an opportunity to continue to use these advances in targeted and systemic therapy while delivering radiation therapy either at the same time or with less side effects before or after systemic therapy. One of the real exciting things about proton therapy, for example, are publications that are demonstrating a reduction in bone marrow toxicity or a reduction of blood counts with proton therapy compared to some of the best photon technologies. What that means is if you're not affecting the bone marrow or the blood counts, our colleagues in medical oncology may be able to give more advanced doses of chemotherapy and potentially reduce some of the combined modality toxicity. That also means we may be able to start increasing our radiation doses without adding toxicity. Higher doses have been associated with a reduction in local recurrence. Proton therapy gives us the ability to increase dose without adding side effects and gives us the ability to combine our treatments with chemotherapy in a way that doesn't result in an overlapping side effect. Another advantage that we haven't necessarily discussed is the advantage of having proton therapy in a smaller scale right next to your cancer center. Many of the best proton plans that have been published, the papers that demonstrate efficacy and advantages of proton therapy, have used both photon and proton therapy together. And in the smaller, more easily manageable footprint of the Proteus One, it's our hope that we may be able to use proton therapy as a boost for some patients, or perhaps even combined with photon therapy in some patients, so that to our patients, all of these advantages will be in one site.